Yes, welcome to the platform. I can see my friend King Ray is in the house. King Ray, welcome to the platform. One of my best friends online is the King Ray. Her videos are so cool. She is a cool person, and the King Ray, welcome, welcome to the platform. If you are watching, please support the King Ray. She's a nice lady. Now, today there is a request that was so anonymous that I talk about uh, irritable bowel syndrome. You know, when it comes to syndromes, syndrome is something that does not come acutely. Syndrome is something that comes and stays and disturbs someone for some time. Or a syndrome is a multitude of complications, several issues that accompany something, and it is not treated once, it is treated by a therapy. So we are at a week of doing a month of doing problems concerning the stomach, problems concerning the stomach. So it was a request that I do IBS. I know some people have always been uh, gone to hospital several times. Every time you are given medication within a short period of time, you are okay, and then you come back and get the same problem again. So today we are going to study and know if my voice is not okay. Please, tell me my voice is not okay so that I shout. But today I cannot shout. Some flu hitting me hard. Some flu is hitting me hard. So if you are in the platform, the chat is open. You can ask a question, any question that you want. You can raise your concern, and you can even usher your friend by sharing, or you can discuss something on the chat. We have the chat there that you can discuss something that you like. But today is a day of irritable bowel syndrome. We know the word irritability is something that disturbs someone for some time. Irritable. If you tell someone you are so irritable, this means that this thing is disturbing. This thing is something that always disturbs someone. Irritable bowel syndrome. Bowel is a name to say your things that are in your abdomen. What is in your abdomen? In your abdomen, we got the stomach, we got the ascending colon, we have the transverse colon, we have the descending colon, we have the appendix. All that is a compilation of something that is in your abdomen. But you see, that is the bowel. That is the bowel. So today we are talking about irritability of the bowel, and it's a syndrome, a compilation of several things that disturbs your stomach. So it's a nice if you have a question as we continue, you just ask. The chat is open for everyone as we continue. So what is irritable bowel syndrome? Irritable bowel syndrome is a chronic disorder of the gastrointestinal tract. It is something that is chronic, something that comes always. You treat and it comes. Characterized by recurring, it is characterized. You feel recurring pain in associated with bowel habits, like you may have diarrhea, constipation, or both. Diarrhea, constipation, or both. You remember we talked. Greetings to you, Dr. Benjamin. Yes, welcome, our Jamaican uncle, my good friend. I'm still pushing on with my flu. I'm still pushing on with my flu, although I'm alone here now in the office. I don't have a mask. Yeah, I don't have a mask, but my voice may be low. So if you feel my voice is low, you ask. You say. We have said it is characterized by bowel habits including diarrhea, constipation, or both, without structural or biological abnormality detected on routine testing. You understand that? Listen to that. without structural or biochemical abnormalities detected on routine testing. Imagine you're going to the hospital, they test everything, and then you are told we can't find anything. The only thing that is remaining that is you have irritable bowel syndrome. So guys, let's bring the people here. Let's associate, let's have experiences from other. When you share a video, it brings so many people, and when you have a channel even new, it is shared, it is impressioned, it is impressioned in some videos. So please don't share the video to have people coming in. It may affect the large intestine, which is the colon, and is most common in young adults. In young adults, we will see why it starts in young adults and not so much in the children. Yeah? Now, irritable bowel syndrome is defined as a disorder of the gut brain interaction. Your gut, I've said the stomach, the colon, ascending transverse and descending colon, and the small intestine, characterized by pain-related dutification. Defecation is going to the long colon, and changes in stool frequency or form. You see, this is a process. And when we say gut versus brain interaction, gut, whatever that is in your stomach is controlled from your brain. So when we talk about irritable bowel syndrome, it means much of it may be controlled from your brain. Much of the problems may come from your brain. Let's work with everyone and see what is going on here. What is going on here? Diagnosis is commonly based on Rome criteria. There is a criteria called the Rome criteria that we will see about what is Rome criteria, how to diagnose. But before we continue on Rome criteria, we want to know epidemiology, how it affects people and population that is mostly affected. The population that is mostly affected. We want to know because yesterday, when we were talking and going through some things, you had some people said they suffer from irritable bowel syndrome. Irritable bowel syndrome. Let me do this. If it will be need, we do some pictures. I'll change to the software. So if you need some explanation through the pictures, just tell me. Okay. As you watch, please don't just watch and go. Please watch and like as we discuss issues concerning our stomach. Now, how does it affect people, and which class of people or which population is mostly affected? Uh, 10 to 15% of global population, more common in women. Women are really affected by this. Usually begins at 40. We usually say life begins at 40. Life begins at 40, my friend. Let me let me stop there and pause a bit. It really, I now know why people say life begins at 40, because this is a time whereby all your, please feel free, better soon. Yes, thanks, Jamaican uncle. Thanks. You this, when it comes at 40, this is where the everything that an adult life wants to have achieved or be in the process of achieving. That is where we say life begins at 40. The process of achieving or all achieving. And this is a time where adults have children, they have, let me say, resource manipulation, and also they're aggressive, creating several important things in life. So your brain is at work, and that's why we say irritable bowel syndrome, you've seen, is a relationship of the gut. The gut, when I'm saying the gut, the abdomen, and the brain. And here we say it's mostly women before age 40. Eh? High associated with stress and psychological disorders. Yes, we will see why. But there is classification and types of IBS. Types of IBS, types of irritable bowel syndrome. What are the types of irritable bowel syndrome? IBS-C. IBS-C means you have pain in your stomach, constipation is predominant, and you know what constipation is, unable to pass out too. And then we have D, IBS-D, diarrhea. You are having a massive diarrhea and pain. And when you go to the hospital, they try to take a laboratory test on your stool, on your blood. There is nothing that is bringing this diarrhea or constipation. But we have the mixed one, mixed diarrhea and constipation. Today you have a diarrhea, you get dehydration, and then tomorrow you can't even pass stool. It is so hard. Eh? And then we have unclassified. You have both of the IBSU. You can have both. Eh? But we see, let's see, something called how do we know that we classify this person has IBS? Because you cannot just have a diarrhea. Maybe you walked in to you are a person who likes events. You like where events are, or your work relation is event management. And you know when it comes to event management, you work in any event and you eat everything there when you are hungry. And then you start saying it is IBS. I'm used to IBS. You know, wrong criteria for irritable bowel syndrome says recurrent, when you have recurrent abdominal pain, at least 1 week per week, once per week in the last 3 months. In the last 3 months, you have a diarrhea at least once per week and associated with the following: at least a diarrhea once per week in the last 3 months. So that one means once a week, every week you have a diarrhea. Every week you have a diarrhea. You see, and that diarrhea once a week or twice is related to pain related to defecation. Pain improves or worsens after you pass stool, you feel pain. And then there is a change in stool frequency. Change in stool frequency, more frequently bowel movement or less frequent bowel movement. Bubbly breath, high bubbly breath. I see you are here. One of the people who requested for irritable bowel syndrome is bubbly breath. So bubbly breath, we are continuing. We haven't gone far. So we are saying you can not just work in a hospital. You are having events now, then, and there, and then you say you have irritable bowel syndrome. Maybe the food you are eating are not okay, but here is the true definition of irritable bowel syndrome. The true factors that categorize you having irritable bowel syndrome. And we have said another strong point that life starts at 40. Everyone says that, and we have seen people aged 40, mostly women, are the ones 40 and above, mostly women are the ones who get IBS. So we are categorizing irritable bowel syndrome and classifying it as this. When you go to a doctor and then a doctor classifies it and says you are having irritable bowel syndrome, this is the criteria that the doctor follows. The ROM criteria, we call it the ROM criteria. And we have said in the ROM criteria, the first thing you will be having is diarrhea at least once a week in a period of 3 months. At least once a week in a period of 3 months. And you see, it can be recurrent abdominal pain, occurs at least once day per week in the last 3 months, and it's related to pain in defecation. When you are passing stool, you feel pain. When you are passing stool, you feel pain. Yeah? Or when you have already passed stool and you are relieved, you start feeling pain. Changes in stool frequency, most frequent bowel movement or less frequent bowel movement. You see those changes, more frequent or less frequent bowel movement. Changes in stool form. It changes to loose, watery, and at times it goes to hard. You start having stool, hard stool. Thanks for the like as they increase. If you are watching and feeling this, please just just have my like, share to some person who may be undergoing irritable bowel syndrome. Let's grow together. Let's share good information that can help someone. No, those ones are the three things about stool: pain on defecation, frequency of stool passing, and change in stool appearance. Sometimes hard, sometimes water. Time requirement, that is another one. Have started at least 6 months before diagnosis, but active in the last 3 months. Not that one that has been treated and then you are okay. This, the stool movement and bowel should have started. If you want me to repeat, because me, I'm going slowly today, if you want me to repeat it, please let me repeat. This is how we categorize that. Hello, Rogers Killer. Thank you a lot on being on the platform, Rogers. I miss Kisii. I think we one day I'll come to Kisii again. I met Rogers in Kisii. Yes, I had gone there and then we met in Kisii town. Now let's continue. If you are following, please, if you have jumped something, ask. The first point that I've said when it comes, don't forget to have a like. Don't just leave the platform. Hit the like button. Hit the like button and share if you can. If you can share in your other platforms, or if you can share to a friend to come and listen, it is good that we share this information. Maybe when a friend is going to hospital, this friend cannot be misdiagnosed. Yes, you are welcome again in Kisii town. Yes, Rogers, thank you a lot on your welcoming note. Boss one, thanks a lot. Now, the first thing we have talked about is recurrent abdominal pain. But this abdominal pain should be at least once per week in 3 months. Once per week in 3 months. But there is associations. This once per week in 3 months should be associated with pain in defecation. Or after you have removed stool from your stomach, when you are from the loo, you start feeling pain. Changes in stool frequency, the bowel movement changes, and sometimes changes in stool form. You have a diarrhea, watery stool or lumpy stools. You check it out. This is the first criteria, pain plus stool. But the requirement is it must be at least 6 months before diagnosis, but active in the last 3 months. So it's not a factor that you've had today and then you walk in a hospital and then they tell you have IBS. No, irritable bowel syndrome is a syndrome. It is characterized and diagnosed over time. You get, guys? If you want to understand anything, please ask. Now, that is the important part when it comes to IBS. Please, let's if someone is here who can post some people's links who are YouTubers, post as we go. If people come in, they'll go through the link. Please, if you are here and you can share a link, Rogers, please help me in that. Help me in that. Help me in that. That is your jacket. Help me in that, tafadhali. Let's give people some stuff. Margaret in Norway. How is Norway? Hope you are doing good, Margaret in Norway. And we are talking about today irritable bowel syndrome. Now, IBS subtypes. IBS. I'm from Kisii too. Yes, I was there some times ago, but in a hurry was one. And when I'll be there, I'll make a call so that we can meet and interact, boss one. Don't worry, one day I'll be in Kisii again. I met Roger Skiller and it was a good moment. We really had fun on the way as we were driving back to Nairobi. It was fun. Magnet in Norway, how is the going? Hope you are doing good. So today we continue on subtypes. on subtypes of irritable bowel syndrome. Irritable bowel syndrome, we have said C is constipation, D is diarrhea, M is mixed constipation and diarrhea, and U is unclassified. But it has to go for 6 months or so, and at least 3 months active. 3 months active. If you have a jacket, please share people's links of their channel so that we can interact and form a good community. Interaction is good because when you share a person's channel here, a person links and then it increases the person's impression. So when people are watching YouTube all over, YouTube gives the impression of that channel. Okay, now we say we have characterized it, and there are some key symptoms. Key symptoms when it comes to irritable bowel syndromes like bloating, abdominal distension, and we said abdominal distension comes from the colon, megacolon, excess gas and flatulence from the stomach, mucus in stool because your stool stays a long time in your gut and then it is not digested, it starts forming mucus because of some bacteria. Incomplete evacuation, urgency to defecate. But remember, when you start having blood in stool, and intentional weight loss, you start having weight loss, fever, anemia, diarrhea, this one means you have to be seen and it is important you go to the doctor. Now, in irritable bowel syndrome, we have said about the brain in relation to your abdomen. So gut-brain axis dysfunction. The gut and brain communicate through neural, hormonal, and immune pathways. You see, your brain communicates to your stomach. Please don't just live without giving a like. Let's learn and like and interact. So when you are in my platform, hit a like button. As you hit a like button, you ask me a question, you ask your friend a question, you interact. If you have ever had irritable bowel syndrome, give us the experience. How do you manage it? But remember, we have said, yes, Rogers, thank you so much. Give that Margaret in Norway. Please, if you have not followed Margaret in Norway, follow Margaret in Norway. See how she's a jovial lady. Now, gut-brain dysfunction. We have seen it hits people that are going age like 35, 40. The gut and brain communicates through neural, hormonal, and immune pathways. The axis involves central nervous system, which is the brain, enteric nervous system, which is the gut nerves, the stomach nerves, the gut nerve, the nerves that control the stomach. One of them is called the vagus nerve. And then autonomic nervous system. Autonomic nervous system says the control that you have no control on that nervous system. Like digestion, like swallowing, you have no control. Your body does it automatically. You cannot control. Hormones and neurotransmitters that are in your system. So these are the related things that help you when it comes to digestion. But here you find there is a problem. There is a problem. In IBS, stress signals from the brain alters intestinal motility. When you are stressed and you are not okay, the central nervous system, the enteric nervous system, and the autonomic nervous system, that's what? Yes, it is disturbed. So you start having inflammation of the wall of your intestines. And digestion changes its course. The gut, the abdomen, the intestines plus the stomach sends abnormal pain signals back to the brain. It starts sending abnormal signals to the brain. And that's why when you go to a hospital, when you come to a hospital, and you have a diarrhea, you are told go to the laboratory, let them take stool sample, let them take blood to see what pathogen is in that, so that we can treat it. But then nothing is found. Nothing is found because, one, this is central nervous system, enteric nervous system, and an autonomic nervous system. There is no relationship between it and what? And any pathogen. So there is no pathogen that is found in your system. Please, if you have suffered irritable bowel syndrome, tell me, and we're gonna learn even the complication of irritable bowel syndrome. We have gone through the criteria of irritable bowel syndrome, how to say this person is criteria, and you've seen it is diagnosed within 6 months, and it should be active within 3 months. Watery stool, incontinence of stool, hard stool, constipation, all of those, you have pain. Now we say the nervous system is the key role, takes a key role when it comes to irritable bowel syndrome. Like, if the vagus nerve is irritated, the vagus nerve is irritated, what happens? The stomach cannot digest the food well. Eh? The vagus nerve, we call it vagus because it's vague. It works everywhere, from the brain to your stomach to your everywhere. So it controls digestion. It controls digestion. Don't just listen. Let's interact, my guys. Let's interact. Let's know what is going on. And tell a person to like the video and share somewhere. Even if your child is a medical student, it will be a good platform to interact and this medical student to get more knowledge on how to handle some things. So share this even to your children so that they can ask me questions. I like interacting with students a lot because they at times they ask you. They I'm here in the background. Mercy Grace, thanks you a lot. Everyone, please, someone paste a link to Mercy Grace platform. I say students, when they interact with you, you are given challenging questions and they challenge you more to do some research. To do some research. Now, we continue here and say, we have said the first point is the nervous system. Abnormal gastrointestinal motility is the second one. Intestinal muscles contract rhythmically with food. In IBS, this is the contraction. When food goes down, what happens? It, the above in the gut, the above constricts and the down one opens. So food cannot get a reflux so that it can go down. It can go down smoothly. It can go down smoothly. But in IBS, contractions become too strong or too weak. This one, it increases rapid transit, causing diarrhea. So when the contractions are too hard, the vagus nerve that comes to your brain hits hardly and it goes down so strong. You have a diarrhea because food should go slowly so that it can be digested. You get it? Decreased motility, slow stool movement, slow stool movement. Yesterday we were eating cakes in Jamaican Uncle's channel. Even here you can hit cake, hit the like button. Don't fail to subscribe to a person here. Subscribe to your friend so that even you can grow. When you are in life, let me sing this song. Blessed is the hand that giveth, than the ones that taketh. Blessed is the hands that giveth, than the one that taketh. Where he is, R.I.P. Lucky Dube. So good song, inspirational. So blessed is the hands that giveth. Hit the like button and subscribe to a person who is watching me, so that your impression can increase, so that you can get more subscriptions. And when you are smiling to the bank, as my friend Marwa does, don't forget to help someone somewhere. it is good to help someone. So we are continuing. When it is decreased motility, I like singing, so I might be singing and breaking sometimes, and I like dancing. It relieves my spine. It relieves my spine. Yes. Now, when it is decreased motility, what happens when it is decreased motility? Slow movement causes constipation because the food is overdigested and the stool becomes hard. You see, this is another form of Namaste, brother. Namaste, Namaste from Hello Life from India. Welcome to the platform, and you should send me your number so that when I'm live, I can be Hello Live. Uh, Send me your number on my email. I'll be WhatsApping. I'll be sending you a WhatsApp when I'm live. At Hello Live. Hello Live. My email is this. Benja Okwesh. That was my email address. So when I'll be coming live for discussion or we want to do some collabos, I will be sending you a link. People, Hello Live is a new here. Hello Live is new here, and please welcome him from India. Very nice brother. If he has a channel, follow our brother from India. Let's uplift his talent. Let's make him grow well. We know we are one blood, all the world. Yes. Now we continue in Botswana. I've typed the email. I've typed the email. Uh, Rogers, boom. How is you, sir? Sir is a good place. Is a good place. Now we have said there are two. Let me continue. Increase in motility and decrease in motility. So when you have a problem in contraction of your stomach gut, what happens? Rapid transit causes diarrhea, but slow transit causes constipation. Constipation. So there is another one called the visceral hypersensitivity. Major mechanism, visceral hypersensitivity. Patients with IBS have increased sensitivity to intestinal nerves. The intestinal nerves are the vagus nerve. Even small intestinal stretching causes pain. Because when you irritate a nerve, what do? It causes pain. It causes pain. So sensory receptors become hyperactive. When you eat a lot and your stomach becomes full, you start feeling pain. Brain intercept normal gut activity as pain. So people have, you see, people with IBS, irritable bowel syndrome, are strongly affected by the nervous system. There's nerves that go to the stomach, the nerves that go to the colon, the nerves that, and you know, that nerve is called the vagus nerve. It goes everywhere. It is called the vagus nerve. The vagus nerve is a nerve that sends signal to, to the brain. The vagus nerve. We have several nerves of the brain. They are called the cranial nerve, including optic, oculomotor, trigeminal. There are 12. Hypoglossal, the tongue. You see, the eye, trochlea, the facial, the abducens that controls movement of the eye. So the vagus nerve, cranial nerve number 10, it is the vagus nerve. We call it the vagus because it goes everywhere, including the stomach, swallowing. It helps in everything. But we have 12, so we have 12 nerves of the brain. So here we are talking about the nerves that help in digestion. One day we will talk about the nerves that help in seeing. The sixth nerve, the abducens, and the trochlea. Now we have said patients with IBS have increased sensitivity of intestinal nerves. You get it? Even small intestine stretch causes pain. Sensory receptors become hyperactive. Brain intercepts normal gut as pain. The brain just see if the gut stretches a bit, the nerve picks it and it intercepts as pain. So you start feeling pain. That's why when you go to a doctor with and you have been you have been diagnosed as IBS, please don't just watch as you come in, like as we go, like the talk as we go. If you have a question, ask. You know, yesterday, so I think it was Bubbly Beth who asked if amoeba can cause IBS. I see now you are answering your your question slowly by slowly. So example, normal gas mild pressure. When you have gas in your stomach, it gives mild pressure and you still feel pain. In IBS, severe abdominal pain. You get it? Now, we have intestinal inflammation. Some IBS patients develop mild inflammation in the intestinal mucosa. This occurs due to increased immune cells. There are some immune cells that are called mast cells. The mast cells, cytokine release and post-infection changes. Maybe you had an infection and then it changed how the immune cells come in your stomach. So they're just released. I can see people are coming in and so many. Today we are not getting today we are not getting questions. Please, if you are not understanding something, let me just not talk. Please ask, because this thing that I'm talking may help you and they may help our future generation. If you have a child or a student somewhere who is doing a medical course, share to this student my channel. This student will learn a lot and they'll be at liberty to ask me anything on the platforms I use. You may be helping your student so much. Please encourage like so that we create more impression. If you have not hit the like the like button and share to your students. Even your children who have smartphones, they may learn and they may help when it comes to matters emergency. You know, children learn and they capture and they use what they have captured immediately. They are not afraid to practice what they've had and what they have captured. So share this video to them and let's bring up children that are responsible and good to the society or when it comes to emergency issues. Now, inflammatory mediators are like causes pain and altered motility. Hmm? This inflammation is caused by cytokine release. There are some hormones that are released and some neurotransmitters and chemicals in your stomach when your stomach stretches that tells you in your brain you are satisfied. But this turns out to be for a person who has this problem of hyper nerve issue, it will be turned into pain. The brain will sense it as pain. So when you have an infection, let me say salmonella typhi like amoeba, and then it is healed, it changes how it changes how these neurotransmitters are released and chemicals in your stomach. So the brain starts to think it is pain. It is pain. So this one can be post-infectious IBS, salmonellosis, shigellosis. Salmonellosis is the typhoid. Campylobacteriosis, those are things that make our stomachs not to settle. Those are pathogens. And mechanism of infection, most infection we just talked about amoeba. You remember they damage the intestinal lining, the mucus lining of the intestines. They destroy it. So when they destroy the intestinal lining, what happened? You start having this problem. Can this condition be reversed? Yes, boss one, it can be reversed. You will see how we can help when it comes to irritable bowel syndrome, but you cannot take drugs in a week and then you are okay. You see, it is connected to the brain and the gut. So it is a matter of stabilizing some hormone and neurotransmitters. Yes, let's continue. You see, Hello Live is connecting to people, and that is what we want. We want a stretch of people to connect, so that when we are live, we connect. We connect. Yes, yes. Let's continue. Hello Live. Thank you so much for that. Let's continue connecting to our friends. And when you are watching, please like as we continue. You see, damage to intestinal lining, persistent inflammation, and altered gut bacteria. What are the symptoms? The symptoms we said from the beginning. One is diarrhea, which can be at least once a week for the next 3 months to 6 months, or constipation, or when you are going to the loo, you feel pain when you are passing stool, or after you have passed stool, you start feeling pain. The main symptoms when it comes to the main symptom when it comes to what is happening here. The main symptom when it comes to IBS is diarrhea and stomach pain. And when you are going to the laboratory to be checked what is happening, there is no pathogen that is found. This is related to nerve pain. Nerve pain. If it was your legs burning, we will say it's neuropathy. But you see, it is irritable bowel syndrome because it is the stomach, bowel. That is it, boss one. Now, gut microbial imbalance. You know, in your stomach, especially the colon, I've said we have the yesterday. If you look at the pictures I was putting yesterday, there is a descending colon, there is an ascending colon, and there is the transverse colon. There are some bacteria there that help you to digest food, but when they are not there, digestion slows and you start having constipation, and constipation brings the gut, the colon, to become bigger and stretch because food is not passed. You get it? Food is not passed. So when food is not passed, what happens? When food is not passed, gas builds up in your stomach, and then bloating comes in. Bloating comes in. If bloating comes in, digestion cannot be done well, because if food is staying too long in your stomach, it becomes stale. Eh? Sanjavio, namaste, brother. Sanjavio is new here, and we welcome you. We welcome you, Sanjavio. This is my main channel, brother. Welcome, Sanjavio. Welcome. Where are you from, Sanja? I'm watching from India. Welcome. If you have not subscribed, please subscribe and share this platform to your friends in India. Yeah? You see, we have Hello Live from India. Today we have Sanja from India. And if you have a channel, please let's follow you. Let's see what you are doing in India. Let's be positive in life. Let's help each other in growing. And I usually say, when you have followers and you are good and you are smiling to the bank, don't just stay there. Help someone in India, help someone in Africa, well, help someone in America, where you are, everywhere. Here we are team positive. We talk about medical issues. We talk about mental health. We assist each other in pursuing problems that this person cannot pursue, because we are team positive. Benjamin, the wise guy, is always team positive. I like smiling. I like dancing. I have true kind heart, and I don't like pain. That's why I talk about how to eliminate pain. So let's continue with irritable bowel syndrome. Irritable bowel syndrome, we have said, the consequences of removing the gut bacteria after you have gut microbial imbalance. You see, the intestine contain trillions of bacteria that help you in digestion. So when the trillions of bacteria are not, after you have taken a lot of drugs, maybe, good bacteria decreases, harmful bacteria increases. So bloating becomes a lot, immune activation changes, altered digestion and gas production comes in. Now, conditions related to This includes small intestinal bacterial overgrowth. The bad bacteria overgrows, and then you start having irritable bowel syndrome. There is another one, another point, serotonin abnormalities. Serotonin abnormalities. Go go Daisy, greetings from Zimbabwe, Dr. Benjamin and everyone. I in its hospital we have children, so if you hear someone screaming, just know children are getting better and they are screaming everywhere. Yes, here, everyone here, thank you for very informative information. Thank you so much, Gogo Daisy. Share it to your children, your students, the children that are in class, so that they can also learn from me. You know, I like people, I see you too, Boswan, to learn. Gogo Daisy has a channel, Mercy Grace has a channel. Please post their channels here. If you have not followed them, and you are watching, please follow their channel so that we grow together. Now we continue on serotonin abnormalities. About 90% of serotonin in the body is produced in the gut. And you see, serotonin is happy hormone. It's a hormone that keeps you happy and you feel good. Serotonin controls intestinal movement, pain signaling, and secretions. In IBS, in irritable bowel syndrome, excess serotonin, excess of it increases motility. So when you have a lot of excess serotonin, what happens? It increases motility. You start having a diarrhea always. Eh? If you have not started this video from the start and you are a victim of irritable bowel syndrome, please start this video from the start so that you can understand step by step. And you see, today I'm moving so slow so that we can understand and we can move on to better. Now, excess serotonin increases diarrhea. Reduce in serotonin above the normal, that hormone, it can give you constipation. It will give you constipation. Now, there is psychological factors. Psychological factors. This is where now we talk about the mental health of a person. This is where we come and talk about the mental health of a person. Hmm? Anxiety, depression. We have talked about the mind and the gut. Stress and trauma. You may be having stress, depression, and anxiety and depression, and you are thinking about what? Maybe you have amoeba, maybe, and the stress you have is the one which is giving you constipation and leading you to IBS. Stress activates hypothalamic pituitary adrenal axis in your brain, leading to cortisol release. Cortisol is a steroid that your body produces, and it increases gut sensitivity, alters intestinal motility, increase intestinal permeability, leaky gut. You see, your intestines, they have some pores that push water in and out. So the immune system, if you release so much serotonin, the hormone, what happens? Immune system changes, inflammation occurs, nerve stimulation occurs. And we have said when the nerve is stimulated in your stomach and inflammation happens, you feel pain. So symptoms of IBS may be abdominal pain. If you have a question, my friends, please don't fail to answer. I like everyone to understand, and we move slowly by slowly as you understand each other, so that we can know how to help our friends out there. Now, bloating, excess gas, diarrhea, constipation, mucus in stool, feeling of incomplete emptying is a very common thing when it comes to irritable bowel syndrome. Now, let's go to something we call extra intestinal symptoms. You've had IBS for so long, and now it is not IBS again. It is causing other problems. Hmm? Fatigue. If you have excess gas in your body, much of ammonia, eh, constipation, you will have fatigue. Hmm? Sir E. A. Good morning, Sir E. And hyphen A. Welcome. Welcome, Sir E. If you have not liked my video, please just like my video. And if you've not subscribed, give me a subscription. I know, Sir E, you are my person. Just like the video, share it. If you have a student in your home who is doing medical course, let's share this platform to the students. Let them learn. Hmm? Now, we have said extraintestinal symptoms, anxiety, sleep disturbance, headache, back pain, fatigue. All those are brought by irritable bowel syndrome. Headache comes because of the gas that is produced in your stomach and the loss of electrolytes. Diarrhea for so long, when you're having diarrhea for so long, you will have headaches. Now, what can make you have, when you are diagnosed with irritable bowel syndrome, what can make you start feeling the pain? What can make you activate the pain? Let's talk about it. Because when you are diagnosed with irritable bowel syndrome, there are some things that you can be diagnosed with, and then at least a minute. Yes, there are some things that you do, and then you start feeling the pain. What are these things? One, the most common one is stress, and you have seen stress can produce like a hormone called serotonin that can bring damage in diarrhea, cause diarrhea. There are some foods that you eat that can bring pain. Fatty foods. This is a period where we really need to listen carefully, because if you have, I know one or two people here have been diagnosed with irritable bowel syndrome here. If you have been diagnosed with irritable bowel syndrome, please listen. Good to see you, Sir E. Okay, listen to this: stress, eating fatty foods, dairy products, caffeine, alcohol, large meals. A person with irritable bowel syndrome should be eating little by little to avoid diarrhea and overstretch of the gut wall, overstretch of the abdomen, overstretch of the stomach. You see, you should be eating smaller foods. And then we have food intolerance, we have hormonal changes. You've seen in the people who have irritable bowel syndrome produce some hormones in large amount or small amount. The key hormone we have seen here is serotonin, which is also the happy hormone, but it destroys the stomach sometimes when it is in large amount. And then artificial sweeteners. Artificial sweeteners, those people that say, I don't take sugars, but you in tea, but you are using sweeteners or fructose. As per my experience and learning, if you are not using sugar, stop using sweeteners and honey, because all those are the same thing. Although they are different compounds, but they give the same thing. So you may say that I don't like you using sugar, and on the other hand, you are using uh, okay. On the other hand, you are using another compound which can bring the same effect. It's not worth it. So certain medications can bring, like NSAIDs. NSAIDs are drugs that are painkillers like diclofenac, brufen, aspirin. Those can irritate your. So when you are diagnosed with irritable bowel syndrome, don't take NSAIDs, don't take diclofenac, don't take aspirin, don't take brufen. A doctor may not give that when he knows that you have this problem. Now, complications of irritable bowel syndrome. We are about to end, people. So if you have not given me a like, please give a like. If you have not given me a like, stretch your hand, give me a like. Let's appreciate as we grow together. And this is the time that now I expect if a person has a question, if you have a question, this is the part now. It's 55 minutes now. I have like 20 minutes. If you have a question, this is the time I'll expect you to as I finish. If you have a question, feel free to put it on the platform and let's interact. Let's interact. IBS does not cause structural damage but lead to chronic discomfort, poor quality of life, because if you are living with pain and you are living with your gut being having inflammation, you will have poor quality of life. Malnutrition in severe diarrhea, because when you are having a lot of diarrhea, you might get kidney injury because of hypovolume. You are losing a lot of fluid and nutrients and even electrolytes. Mental health problems, because if you have a problem that is not getting away, you will start having mental health issues. But uh, there are some things that we need to know before I finish. Before I finish, there are some things we need to know. Anyone with a question, please put it now. If you have a question, put it now. But my email address I've already given out. If you have a question that is not public, just post it there. Do you have a WhatsApp group for notifying us when you are live? Um, this one now, if I will say that is a very important question to boss one. You know, some people don't like giving their numbers. Some people don't like giving their numbers, but if you everyone here has 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 is okay with giving out the number, let me give a number. This is my number plus two, the number that you can text me so that I can form a WhatsApp group. Just say from Benjamin the Wise Guy, then I'll form. This is my number plus 25407. That is the number. You can text on that number. Every person who can feel like we can form a WhatsApp group. Sorry, we can form a WhatsApp group so that when there is a maybe a topic that you really want to follow, I'll be posting it there. That one is the number that you can use. You text me, then I'll form the group, or my secretary will form a group, and wherever that when I'm live, you will see a link there, or put on the notification bells. Yes, that is important also. Put on the notification bell. But if you are okay with having my number, that's it. We can form a group that will be shared there. Uh, Here in diagnosis, I'm finishing now. Doctors, thank we need a group number. Yes, uncle. If even uncle is attesting to it, Dr. Benjamin, we need a group number. I've given it that one for now. Let me see. Yes, that is. We can use that one as a group number for now. Everyone who can wanna be in the group can text me on that. Then I'll form a group. Just text me from Benjamin the Wise Guy, and I'll form the group. I'll form the group. So when it comes to, yes, thank you, doctor. WhatsApp is better. Thank you a lot. When it comes to the diagnosis, we have seen the criteria, the wrong criteria. If you are away and you entered in the middle, you will see the we have seen the wrong criteria. The wrong criteria helps us to diagnose immunization. Just a minute, I finish. I call. The ROM criteria shows us how we can diagnose the IBS. Please start from the beginning, but there are some things that we do. We rule out things like Crohn's disease, ulcerative colitis, and celiac disease. The next topic is, you may confuse this Crohn's disease, ulcerative colitis with IBS. So I think tomorrow I will do Crohn's disease, ulcerative colitis, and celiac disease. You'll see they kind like seem together. You may be done tests like stool tests, blood tests, and colonoscopy imaging to look at the gut if it is okay. Diagnosis is usually clinical by Rome criteria. Now, treatment includes lifestyle management, regular exercise, stress management, adequate sleep so that your nerves can calm down. Dietary treatment. How is your diet? How can your diet be? Your diet should be low food map diet. Avoid onions. I'm going slowly here. Avoid onions, beans, wheat, certain fruits, and artificial sweeteners. Increase in fiber. If you have IBS, take vegetables a lot. Hi Miriam, welcome. Increase in fiber. Increase in fiber. Take vegetables a lot and fiber foods. But I've said onions, beans, wheat, certain fruits, and artificial sweeteners are not good for a person who has IBS. Fiber is the best. Eat foods that have fiber. Eat foods that have fiber. Now, when it comes to medication, depending on your type, if you are having a diarrhea, there is something like loperamide. For people who cannot pass stool, there is something called lactulose. Lactulose helps in passing stool. And then we have for pain, hyoscine butyl bromide. That is Buscopan. Because in the stomach, what causes pain is called spasms. So hyoscine butyl bromide, sorry for the network. Is anyone who has a network problem? Please share. Okay. Hyoscine butyl bromide is antispasmodic. It reduces pain. For microbacterial imbalance, rifaximin, or you can take normal floras. They are in the in over the counter. Most of the normal floras, they are sold in pharmacies. Then for people who are stressed out, we do psychotherapy, cognitive therapy, relaxation therapy, and gut-directed hypnotherapy. Now, natural ways to reduce IBS. If you have been with it, you have gone to the hospital, you have done everything, and you feel that this is now the end, eat slowly, avoid triggers food, drink enough water, increase soluble fiber, use probiotics, reduce stress, know how to balance your stress. It is hard, but at times you need to know how to balance your stress. Avoid excess caffeine, maintain regular meals times, improve sleep. That is the natural ways that you can reduce the pain from irritable bowel syndrome. So if you are here and you asked that question yesterday, Bubbly Beth asked me if amoeba can bring it. Now you see, this is a totally different thing from, although we have seen a part where you can have an infection and then you start having IBS. But you see, this is totally different. Irritable bowel syndrome is totally different from an infection. Something that is related to the brain and the stomach, they are totally different. So for if questions are finished, anyone with any question, the number is there. If you need us to create a WhatsApp group so that I can be posting a link, if you have not seen the notification, you can send me a text. Just say from Benjamin the Wise Guy on that number, and I'll create a group so that when I'm live and there is a topic you want us to discuss in here, I can come, I can post it there earlier so that we know what is coming next. Thank you so much for everyone that has been in the platform. and everyone that has subscribed to a channel of someone here, because growth is imminent. And I'm saying again, if you grow and then you become successful, please try and help someone in a village or in your place. Help someone that has no school fees, help someone that has no food. Give this person a platform to step again. People are having more problems out here, and at times I look at and I can't stretch my hand to help, but I do where I can. And I see, oh, right now we don't have any question. Thank you for being here. I'll be at 7 at Jamaican's Uncle. Let's meet there as we stretch a hand. Have a nice day, everyone. Thank you for visiting. Tomorrow we have another topic of ulcerative colitis, and we have said we will have a topic that will Crohn's disease. We will differentiate Crohn's disease with ulcerative colitis, with even the IBS that we have discussed. Have a nice day. Let's meet at 7. I'll be watching Jamaican's Uncle. Good time. Be blessed, everyone.